The inaugural Clinical Quality Strategy Forum was held at the prestigious Norton Park Hotel near Winchester and was supported by a selection of hand-picked solution providers who are committed to driving healthcare quality and innovation. The format, designed to maximize learning, engagement and networking, consisted of presentations, group discussions, panel sessions, speed networking, one-to-one business meetings, together with informal opportunities for networking over hosted lunch and sponsored drinks reception and dinner.
I'm here at the Clinical Quality Strategy Forum to obviously network with other people, which has been fantastic. I don't get a lot of opportunities to meet with professionals from geographically other parts of the country, and I think it's a really good forum to also to listen particularly to the talks on leadership as well. It's a changing landscape out there, so it's so far it's been very good.
We're here at the Clinical Quality Strategy Forum just to try and understand more about the challenges that the various healthcare trusts in various different areas of healthcare face, particularly in terms of embedding the principles of human factors, which can be challenging to do in a sustainable fashion. So it's been really interesting to hear about the challenges people face and how we can help them.
I think that the forum today is the number of presentations that we have. So you might think it's presentation fatigue, but it isn't. If the presentations are in 20-minute bite-sized chunks, there's enough time to understand what people are saying, and we're getting a great variety and volume of presentations, whereas other forums I've been to, perhaps as a presenter on for an hour, so you get less of a volume of different messages coming through. But here it's very slick, it's very streamlined, organised exceptionally well, with 20-minute presentations and then the opportunity to speak to the providers afterwards as well.
It's a really good idea. There's no getting away from the fact that we need to align ourselves with business, with commerce. So that it's a really good opportunity to do that and try and influence them as well as them influencing us.
The good thing about the delegates in the Clinical Quality Strategy Forum is, it's a diverse set of delegates. I've probably only met 2 people that have the same job title or the same responsibilities at their organizations.
What I like about the speed networking is that it's a lot more playful than it is, for instance, the one-on-one business meetings. They tend to be a bit more serious, and you can be, you can make a little joke. You need to interact, and it's quick, and so it challenges me to be, approachable every time you talk to these people, and that gives a really nice dynamic.
The speed networking was fantastic. It gave an opportunity to actually see a lot of the organisations which are sponsoring.
The hotel is extraordinary. It's set around 50 acres, beautiful surroundings, very comfortable location, very good soundproof rooms, excellent food. The lunch was excellent, the breakfast was excellent, and it's a wonderfully sort of located view, and we can see why this was chosen.
Yeah, the business meetings that we've had this afternoon have been very interesting. I think we've had a lot of interest shown in terms of as an organisation, a lot of interest in how we currently collaborate, how we work with other organisations across the NHS. Keen to understand the sorts of initiatives and projects that we're involved in.
I would 100% expect to have follow-up with the people that we've met. People have come to the meeting with the intent of finding solutions to challenges that they have. And on the basis that Drayson Health's products actually meet some of those clinician challenges, I would expect the meeting to actually give us a real good return on our investment.
As a physician, I'm used to these gigantic conferences where you always tend to focus on the people you know. this is perfect for, you know, getting new contacts, growing network. Yeah, I have no advice for you guys, so keep up the good work.
I would recommend this to other people in my organisation to come to, just because of hopefully the relationships I've made today and the conversations I've actually had. And it's always good to come out from the front line and from the operational pressure, just to sit down and have a good think about what other people are doing and make those connections.